you for bringing this up because I think it really talks about why we need the Equality Act. So all of these state level attacks on queer people, a lot of them have the ability to be sort of circumvented by really solid federal legislation. It sends a messages to states, like if you're going to pass discriminatory policies, they can get easily overturned by having a federal policy in place that strengthens protections against the queer community. And one of those is the Equality Act. So I think it's important to talk about what some of the results have been for the LGBTQ plus community and talk about where the policy landscape is right now on a national level. So number one, we have seen some improvements here around people who are non-heterosexual and protections for them, which is based on sexual orientation. So we have very few quote unquote negative, meaning very discriminatory policies for non-heterosexual folks. And we have a lot of high protection policies, which is great. I like to remind people, because sometimes you get comments like almost in the same vein as like us being post-racial as a society. Sometimes we think like, well, we're post-gay discrimination, and that's not true. I mean, it's only been 6 years since gay people had the right to get married. Like, I mean, this is just crazy. And just because people are now putting up pride logos and putting their logos with the rainbow doesn't mean they're actually doing anything to help the queer community. And so this is a source of frustration for me, and why I want to point it out that there are lots of states that still discriminate against people for being gay, even though we've seen a lot of support around non-heterosexual acceptance or whatever or affirmation, however you want to frame that. There are still many states who refuse to protect sexual orientation. But when we look at gender identity, I mean, the board shifts tremendously here, right? So we see tons of states that not only don't have protections, they actually have policies in place that negatively impact people who are non-cisgender. So that would be anyone who doesn't identify with the sex that they were assigned at birth or the gender that they were assigned at birth. And so we see that there are some states that are really doing well and that they have high protection policies, but many states do not. More than half of the states either have negative or low protection policies. And so support like the Equality Act can help regulate some of that and sort of circumvent what states may do to pass or put in place these really discriminatory policies. And so these policies, we see a direct connection on the health and well-being of the queer community, in that they are disproportionately affected from experiencing homelessness, from LGBTQ youth are overrepresented in foster care. We also know that particularly for transgender people and sort of the whole spectrum of gender diversity, that policies like this and even conversations that we have about whether or not transgender people have human dignity and worth in our country leads to these very psychologically distressing outcomes. I mean, I think that's the biggest thing that I talk to legislators about in Texas is like just the fact that I have to come here and talk to you about whether or not a transgender person matters in Texas. The damage is done. The conversation has been had. And so it's really alarming that we see this pattern of, suicidal ideation about transgender people not even wanting to use a public restroom, regardless of whether or not they actually have a policy in place, like a bathroom bill policy in place. They're terrified to do that because of the discrimination and the violence that they would likely receive because of the conversations around that. So that's, we've seen a huge trend here sort of attacking transgender people, but I do want to highlight that the Biden administration has done a lot since coming into power in January. They really have done a lot to protect transgender people in the ways that they can. So number one, I think within the first 100 days, the ban that was put on transgender people participating in the military, that was rolled back pretty immediately. And that was supported by all kinds of military leaders too. I mean, I did not see any public leaders saying, yes, please discriminate against transgender people in the military. And which was why the support for taking it back, there was a lot of support there. But more recently, we've also seen that Biden released, I believe, an executive order about healthcare discrimination, such that if entity receives federal funding, they cannot legally discriminate against transgender people. So for me as a military member, accessing military health care, whenever I would talk to legislators, I would say, you know, my child, if they want to receive transition care, they can go through on a military base and it's considered medically necessary standard care, no issues here. And I think even now, and Colin, you can correct me if this is true or not, but I think if you even accept Medicaid, because that's a federally funded program, that as an entity, you also cannot reject care for transgender, LGBTQ, or queer people. So that actually did a lot to protect us in terms of healthcare discrimination. And then even more recently, Title IX, basically the Biden administration released what they called an interpretation of Title IX, meaning that they believed protections extended to transgender athletes. And so that wasn't necessarily a law. They just kind of said, this is how we're interpreting the law, which does make it a lot more difficult that if you want to enable a state policy, it is easier now to get overturned through a lawsuit because you say, well, you're breaking Title IX, right? So there's been some bright spots, and I think this is a good thing to remember that there are people at the federal level who want to see protections for the queer community and are actively doing work to ensure that happens. And so that's why the Equality Act is an important piece of advocacy legislation that we should be focusing on, because it just strengthens protections for people based on sexual orientation and gender identity. And so we kind of put together some talking points about how and why this is important to oral health. And again, as oral health equity champions, we should really be thinking about oral health in all policies, kind of the same thing as health in all policies, oral health in all policies. If we really want to focus on the social determinants of health and the drivers of inequity, we have to look to things like legislation to protect against discrimination. And so number one, sort of the first talking point that we're offering to the community is that the current protections are not working. I mean, I just presented even a fraction of the data available saying that we see these really profound health outcomes for the queer community because they have the legal ability to be discriminated against. And that leads to more than 15% of queer people not wanting to get medically necessary care because they're scared to do so. And even more alarming is that we do have healthcare providers who will openly and actively admit they will not treat transgender people. And so this would actually strengthen protections, saying, you know, there are some states, again, in Texas, for one, there was a bill put together saying that you could discriminate against basically any patient for a religious ideology. And that disproportionately impacts the queer community. If you don't believe somebody should be gay or you don't believe somebody should be transgender, then there are protections in place who would say you could legally discriminate against them. And so I think there is a need here to pass the Equality Act because there is still active discrimination and people are being really blunt about it. Number two, we know that when people have discrimination, protection from discrimination, they're more comfortable actually accessing healthcare. And we as oral health equity advocates, we know it's not just about giving people insurance. We know that this is also about ensuring that they can access and utilize the healthcare that they may, that they have, you know, insurance coverage for. And so just even getting the first step out of the door to get to your oral health care provider can feel really challenging, particularly if you know that you could be discriminated against as a patient. And so legislation like the Equality Act can signal to queer people that the federal government is sort of on their side and giving them that discrimination protection, and hopefully can help them overcome those fears and of being stigmatized or discriminated against. And then number three is that, again, sort of harkening back to those arguments around social determinants of health, influencers like stress and trauma can impact our overall health, including our oral health. And we've seen this over and over again. When you're living in chronic fear and anxiety of being discriminated against or even, you know, threats of violence, like this is a very real, this is a reality for the queer community. And so the Equality Act can really reduce those social risk factors that do disproportionately impact our overall health, including our oral health. So Colin, is it okay if I throw it over to you? And I'm happy to share my screen and I'll just mute myself. and we can talk about this toolkit that we've developed for the oral health community, and we can kind of go through any questions that you guys have after Colin introduces it. Does that work?
Sure. Yeah, and I'll just add, to some of Annalise's content, just to kind of emphasize why this is important. She mentioned that, the Biden administration did revive some federal protections when it comes to federally funded health programs for LGBTQIA plus people, among other populations. And those were protections that were put in place by the Affordable Care Act. But in 2019, the Trump administration did away with those protections. And so, we have no guarantee moving forward that we're always going to be under a favorable presidential administration. And so if we continue to rely simply on federal regulations, those can be undone again. And that's really why we need to pursue additional legislative strategies to protect people. The other thing I'll mention is that, with regard to the social determinants of health and their interactions with oral health, we heard that many in this community, especially transgender youth, are seeing rises in suicidal ideation and suicide itself. We also know that that poor oral health can contribute to depressive conditions and suicidal thoughts, especially among adolescents. So, not feeling comfortable accessing the care you need to address those problems can compound some of these existing, effects of discriminatory policies. So all these things are really wrapped up in one another. So all that said, Annalise has really just done an incredible job in pulling together an advocacy toolkit on this issue that not only lays out much of the information that she's covered here, but provides you with effectively everything you need in order to raise this issue with federal policymakers, especially. As she said, right now is the time that we need to be going to members of the Senate to ensure that this is passed. It's possible that this could be voted on in the next week or so. So this is really, this is something that needs action now. And so, we've got messaging tips in here, information on how to actually go about contacting your legislators. There's information on some of the partner organizations like the Human Rights Campaign, information that they've pulled together on the Equality Act. And Open itself has some additional resources that can help you do that direct outreach that needs to happen now to members of Congress. And that includes the congressional engagement matrix that Pat Finnerty has done a great job of maintaining for us over the years. Annalise, did you want to walk through the actual toolkit itself here?
Yeah, happy to do that. I think the one thing I do want to point out here, and it's probably good for a follow-up email that I would suggest, at least that's what I did in my advocacy meetings, was pointing people back to the AIDPH Resource Center that has a ton of research. I don't know if anybody's actually going to go to it, but I think it's helpful to know that we are talking about evidence-based strategies. We're not just kind of pulling these figures out of the air, that this is from research from oral health researchers, right? And also a lot of the research that was compiled, at least in part and in pieces, was done through the LGBTQIA NRT, which I would invite anybody to come and check out our monthly meetings. So any resources that we were able to find on education, we threw into this database as well. And so that's a great place to give just a follow-up email and say, let me direct you here. But this is an email to your senators. Again, it has already passed in the House. So we're focusing all advocacy strategies on just senators. And Colin, there was an interesting question brought up in the last meeting in the Medicaid meeting about should we, if we have a Republican senator and they're they may or may not, probably not, will vote for this, is it still important to talk to them? Do you have any thoughts about that?
Yes, I do. I think the short answer is absolutely yes, it is important to talk to them. For one, I think it's always worth taking the chance that you can appeal to them through some of the, the values-based communication strategies that Annalise mentioned earlier, that aren't, simply saying do the right thing, but saying rather, we're the same, we value the same things, and that's why I'm asking you to take this action. But the other thing is that it's always important for us to show just how many people care about an issue. It's critical, especially, that we can show that there are people in a senator or congressperson's state who are calling for this to happen, because at the end of the day, you're the people who are going to vote them in or out come the next election. So even if it's not something that they feel compelled to do or that they believe in, if there is an overwhelming call for them to do something, and they have a sense that, that might be something that is a deciding factor in the next election, they may just be pushed over the line to do it.
Yeah, and I'll add too, again, in Texas, we have very conservative senators. And I can tell you that meeting with their staff members, because I've done this now through Open so many times, like we've done our Hill days, and I've been able to meet with them in person, but then also via Zoom now. And so I've actually been able to develop a relationship with a lot of these staff members. We almost never agree at the end of the day, but now when I do send them an email, I can usually get a meeting within a couple of days because they recognize who I am. We're probably going to walk away with that meeting from a different, in a difference of opinion. I haven't heard a yes on this from either of my senators, but I think that they recognize there are people that are willing to keep them accountable and just willing to talk to them about oral health. And also, if I really do have something that is a good, solid, bipartisan piece of legislation in the future, I have a way better chance of advancing that on behalf of oral health by maintaining those relationships and really building them in a fruitful way.
I agree.
So Colin, maybe you can talk about some of these tips for advocacy, because I know this is something that you guys talk a lot about in the policy NRT, and I think it's really helpful maybe just reiterate how you would suggest approaching a meeting if somebody would like to.
Yeah, I mean, I think for one, I know a lot of us, when asked to take action to contact our members of Congress or our senators, we maybe have some hesitation about, wait, what, can I do this? Is this lobbying? Am I allowed to advocate in this way? And the fact of the matter is, in most cases, the answer is probably yes. Private citizens and members of 501c3s can in fact advocate in this way. If you're a federal state employee, that may be different. There are legislative restrictions there, in the form of things like the Hatch Act for federal employees. But for the most part, when we look across the members of Open, I would say that the vast majority of people are in a position where they can, in fact, advocate in this way. So, I think, the other thing that comes up is, well, what if I get, asked questions about X, Y, or Z? Pushback on certain issues. Annalise, I know that you have some good examples of exactly the kind of pushback that you've gotten on this, so I'll give you a chance to talk about that in a second. But I think, the strategy that I often resort to is a little bit of an acknowledgement and a redirect, especially back to that issue of values-based messaging. And saying, yeah, I understand your concern here, but at the end of the day, what we're talking about is ensuring that everyone is able to get the care they need to be healthy, happy, productive, and tailoring that message a little bit based on what you know about that particular policymaker. So you do want to make sure that you've got a little bit of an elevator pitch to go into that meeting with. Oh, and first, I'll just say, in terms of getting the meeting, I think it's easier now than it's ever been to get a meeting with legislators, especially members of Congress. They're all used to doing virtual meetings and phone calls now. It used to be that you had to set up a time to actually meet in person, and that scheduling was typically pretty difficult. Nowadays, I would say your best course of action is to start with an email, give a quick overview of why you want to talk to them, and ask very explicitly, can we set up a time for a call or a Zoom meeting with you? And 9 times out of 10, you'll get a yes. If you don't, then resort to a phone call, either to their DC office or their state office. And again, that information can be found in the congressional engagement matrix. So once you do have a meeting set up, make sure that you've got an elevator pitch prepared. I find that it helps to rehearse it a little bit, in the mirror or over the phone with a friend or colleague. You want to make it quick. At the end of the day, a lot of these folks have a lot of meetings on their plate. I would say, budget 10-15 minutes tops for this kind of meeting, and expect that they may say, hey, I've got another call in 5 minutes, because that sometimes happens. So you don't want to be caught off guard by the fact that they're going to rush you out the door. So make sure that you've got something prepared that's short, sweet, to the point, and has an ask. Make sure that you if you leave them with one thing, it's the action that you want them to take. And again, incorporate a couple of facts that you find compelling. Even better are personal stories from people in their state. I talked with so-and-so who, has a son, a daughter, a child, a mother, a sister who is experiencing this, and here's how you can help them. Like, here's how that affects their day-to-day life. And then always offer to be a resource to them. I think that just, shows that you're coming to this from a collaborative standpoint, and you're willing to, help them address a broad range of issues moving forward. As Annalise said, part of this is about establishing and building that relationship with policymakers and their staff. It's rare that you'll get a meeting with a member themselves. So, you're probably not going to have a sit down or a face-to-face via Zoom with your senator. If you do, that's fantastic. I mean, that will be amazing, and that occasionally happens, but more often than not, you're going to be talking to a staff member who.
Sometimes you find them in the hallway and you assault them and force them to have a meeting.
Absolutely, yeah. If you're in person, and you see them in the hallway, you should not hesitate. I mean, at the end of the day, they work for you. And sometimes these meetings are going to be very one-sided. I mean, that's just the fact of the matter. Sometimes you're going to have a staff person who sits pretty much silently. Maybe they'll nod, but they may not really give you much of a reaction at the end of your pitch. Again, that's just sometimes the way it goes. I think a good strategy there is just to, put them on the spot a little bit and say, can I count on you to do this? Can I count on you to have this conversation with your boss? And most people are responsive to that, if only because you put the pressure on a little bit, and they want to show that they're doing their job. Sometimes they're going to be late too. I've had situations where I've set up meetings with congressional staff and they're 10-15 minutes late. They had a vote, so be prepared for that. But again, I think persistence is key. Making sure that you're leaving them with a clear ask is key. And again, appealing to, to common values is a really great strategy here.
So there's also this part here with social media messages, which is just kind of copying and pasting from other organizations. I think the messages are similar for any health advocate, oral health advocate, or just advocate in general. So we sort of suggested just using what campaigns are already there and folding into those existing national campaigns. And I'm going to put this in the chat so that everybody has access to it, if I can figure that out without being able to see the rest of my
Or
screen.
you can send it in an email on Elise too.
Okay, sure.
Yeah.
Oh, here we go. Okay. And I think if it's okay, if you guys have questions, we have like